Hey guys, so today we're going to be using the diathermy unit. So right now we have the drum application. So some general parameters before we get started. This is going to be a continuous wave because we want some heat application to the patient. So when doing that, to start the machine, there's a little switch back here in the back. This will turn the unit on. And before we start changing the parameters, we have the mean peak power and our peak pulse power. And you figure out mean pulse power by the peak pulse power times your percent on time. And percent on time, you can see the equation here, pulse duration divided by pulse period. And peak pulse power is going to be your intensity, which is measured in watts. So I'll go over that on this machine here. So since we're doing heat application, we want continuous wave. So we will push next. You will not have to deal with pulse width because it's a continuous wave. And then we want the drum application, which is here. We do not have the pads currently. We'll move on over. Once you push next, it's gonna be able to adjust the time. We wanna apply this for 30 minutes, so just keep pushing the up button until we get up to 30 minutes. Okay, and then next, and that'll take you back to continuous wave. So once you get to that point, you're gonna go ahead and place this where you want it over the patient, but explaining that you do not want it touching the patient's skin at all. And you also don't want any metal on the patient as well, because it can cause burning and other issues for the patient as well, and the therapists themselves. So when we're moving this over the patient, just explaining that they might be feeling some heat once we start the application. And in this case, we're gonna say that we need heat application to increase the extensibility of the muscle tissue. So after the 30 minutes, we'll get the patient up, moving, and get them stretched. All right, you ready to go?
Yep.
Okay, so we're gonna push start. It's gonna calculate for a second, and then we'll be able to increase the intensity. So we want this intensity at a intensity where the patient's going to feel the heat, but it's not burning or stinging or any application of that matter. So we'll go ahead and push start here. How you feeling right now?
Feel fine. Don't feel anything yet.
Yeah, so over time, the intensity, or not intensity, but the heat will build up. It's not going to be a immediate application. And one thing I forgot to do is we have to place a towel between the diathermy unit, the drum, and the patient to collect any moisture that may build. All right, and you just want to check on the patient, make sure they're feeling okay. If there's no pain, continue for 30 minutes, keep an eye on the patient, and once we get done, we'll go ahead and start stretching out the tissues that we're heating.
Starting to feel some warmth now.
Starting to feel some warmth. Good. And that's what we're going for, as long as it's not burning, tingling, any painful sensation. All right.